Hi, Dr. Mohebi from Partial Mohebi Hair Restoration. We are having a very interesting case, a repair hair transplant that has been revised. Patient has had multiple hair transplants in the past, so the donor area is almost gone, and now he has some pockets of hair, and we want to repair the donor area. We usually remove it from the back and put it into the balding area. In this case, the back is all scarred and no hair, and we want to restore the back. Revitalizing the donor area, and we're going to use the beard hair today. How this patient came to us a couple years ago, he had the frontal area was very thin, the corners he had some very high density. Removing some of those hairs and redistributing them in some other areas and add more density to the middle. So now he has a more balance. From the top, before his previous procedure, you see the scars of previous plug procedures. How he looks now. So this is before the last procedure a couple years ago. This is after one procedure that we did for micropigmentation that we did behind his hairline. So we added more pigments here to make it look perfect. And this is how it was, and this is how it is now. As now is the huge donor area, huge gaps on the back that we need to fill. The back is pretty much like all skin. So we have some beard hair and fix those areas. A lot of scars, a lot of areas that needs to be filled, multiple scars and a big scar in the back. We already divided into certain sections that we want to fill based on the priorities. Use the beard hair. We're going to double them up. Most beard hairs are single hairs and they have to be doubled in order to show more density and to survive better. So it's all scarred. The whole area is scarred, multiple scars from before, and we have a hard time making the sites even. So after sites, we're going to start extracting the grafts from the beard area. The grafts into the entire donor area that was depleted, and now we're restoring it with 1,218 grafts. 1,031 single hair, beard hair, and 187 twos, and all singles are doubled because we know when we double the grafts, the survival rate will increase. That's how you double up the grafts. So there's a beard hairs, they're mostly non-pigmented white socials. The only problem is he has to find a good way of sleeping tonight without putting pressure on the back of the head. We're done with the procedure. It was a very interesting case. We don't get to do these challenging cases every day, but every now and then we get to do revision surgery. Revision has to do with the patient has multiple scar revision and a scalp reduction procedure in the past and has multiple scarring that was making it very challenging. So we were not able to do it with his existing hair, so we had to use beard hair. So we use beard hair to restore and vitalize the hair on the back. Let's look at the picture. The donor area, the black stuff are hair color. We had to color his hair that some of the skin was colored too in order to see white hair. Pictures of the back after procedure. The main areas that we were concerned were reasonably covered, and the appearance of the scar is going to be gone, and patient is going to be not dealing with scar and hairless areas on the back anymore. So if you have a scar on the scalp, on the donor area, or anywhere else because of neurosurgical scars or previous hair transplants, it's easy to repair them, even if you don't have enough scalp hair to restore it. We can use beard hair or body hair to restore the hair on the other areas or to revitalize the scar.